All right, so now you see Leah, you see Dr. Garcia. Can you, Tom, say something?
What? Say something? I have nothing to say at this point. Ready to go?
Here we go now.
Okay. Correct my knuckles. There we go. All right. Hello and welcome to another, dare I say, exciting episode of On Your Radar, a podcast for mind, body, and spirit. On Your Radar is made possible by Rosecrance, a leader in addiction and mental health treatment. I'm your host, Tom Farley. Today, we're talking about some of the latest advancements in mental health treatment, including learning a lot about TMS, or Transcranial Magnetic Stimulation. We'll be hearing from experts on the subject, as well as meet two people who have had positive experiences with TMS treatments. To get us started, I'd like to welcome again to the show two of the resident experts on TMS at Rosecrance. First, Leah Scanlon, a therapist and director of Aspen Counseling, a behavioral health specialty group from Rosecrance Therapies, as well as Rosecrance's Chief Medical Officer, Dr. Raymond Garcia. Welcome, Leah and Dr. Garcia. How are you? Good to see you again.
Oh, great to see you.
Awesome.
Thanks for having us.
Yes, absolutely. This is going to be fun. Leah, let me start with you. Give our listeners just kind of a rundown of what TMS is, how it works for patients.
Sure. TMS is a type of treatment that is used with patients that have specific mental health struggles. So particularly depression, or what we call treatment-resistant depression, and OCD, or obsessive compulsive disorder. So these are folks that have been struggling for some time with their treatment regimen. They haven't responded to medication. Maybe they can't tolerate medication to treat their diagnosis, and they may have done multiple rounds of psychotherapy, may have done some more invasive treatments like ECT, and haven't found the relief that they're looking for. And so TMS is a treatment that utilizes electromagnetic energy, similar to that of an MRI machine. It's a device, and so it's actually delivering electromagnetic pulses into the brain. And the goal is to stimulate neurotransmitter production so that it's helping to relieve some of those symptoms.
That's a lot, but I really like the whole treat resistant part of it, because we've developed so many treatments, medications, all these kind of things, and yet some people it's hard and they continue and continue. But this is something a little different. So, Dr. Garcia, how does someone become eligible to try TMS?
So if you go according to the FDA standards, all the FDA requires is that a person, first of all, has a diagnosis of major depressive disorder. That's the primary approval for TMS. There are actually a couple of other indications, depending on which device we're talking about. it has been approved for OCD, obsessive compulsive disorder, as well as for treatment of smoking cessation. But primarily, we're using it for major depression. And for that, the FDA requires that a person has tried and not responded adequately to at least one antidepressant medication. Now, when it comes to getting approved by the payers, by insurance, then they will typically require that a person has tried a number of medications, and that can vary depending on the insurance policies. Some may require, up to 4 trials of antidepressants. They may require a combination of, an antidepressant plus what's called an adjunctive therapy, a medication that's added on to boost the antidepressant. Oftentimes, they'll also require that a patient has had a trial of psychotherapy with counseling. So it can vary, but really it depends on the definition of treatment resistance that's being used.
Yeah, it's interesting. Are the payers comfortable with this in terms of what they require? Is that getting better and easier? To approve
It
this?
is. Yeah. I mean, even over the last couple of years, as Dr. Garcia just mentioned, the standard for a long time used to be 4 antidepressant medications. That was a requirement for the treatment of depression, plus maybe another 2 adjunctive medications added on. And so it got to be, tough when we have folks that are coming in that have been struggling with depression for decades. They can recall going back to childhood, feeling depressed. And so, what is the likelihood that patients coming in can recall the names of some of these medications, the drug classes, and they got really sort of nitty gritty with that requirement. And actually, during COVID, we really kind of saw a shift with some of our payers where they were, slowly kind of changing that requirement, lowering the required trials to 2 in many cases. So I think there is some recognition that this is, a valid and effective treatment because it's non-invasive. We're treating a very small part of the brain. It's localized treatment. It's not like a medication that's going throughout the bloodstream. So you don't get those terrible side effects that some patients experience with antidepressant and sort of, try and pluck one out of the air and hope that works in a couple of weeks.
Has TMS been around a long time? I mean, is this new, or like it sounds like it's pretty established?
Yeah, it was actually FDA cleared in 2008. And we've been practicing TMS therapy at Aspen since 2010. So we were actually the first provider for TMS in Northern Illinois. It's been around for a while. The research actually goes back almost 30 years now when it was first being studied. And, it took some time for it to get cleared. But it's definitely exploded probably within the past 5 years in terms of its utility and availability across the country.
That's fantastic.
The world.
Well, let's dive into the sessions themselves. How long does an actual session take, and what does that look like? What does the schedule look like for the people that have this treatment?
So a typical session lasts around 20 minutes, and so that would be for the depression or the OCD treatment. So it's nice because there is a varying degree of flexibility there. The patient can easily sort of fit it into their day. It is a treatment that the patient needs to attend every day. So it's 5 days a week, generally for about 6 weeks for either protocol. But really the intention is that, this is a high frequency, high intensity treatment. So it really requires the patient to attend every day because we are, again, trying to sort of retrain the brain in a sense to, and how the brain fires and how it releases neurotransmitters. So it's important that they're coming frequently.
You mentioned MRI briefly before, but as a comparison, but this isn't, this full kind of you're just sitting there comfortably in a chair, correct?
Right. Yep. And exactly right. You're sitting in a comfortable chair. At least in our setting, we have a really comfy chair, and it's actually a treatment helmet that actually sits on the patient's head. And the helmet itself has embedded coils. So depending on the type of treatment that we're doing, the structure of the coils could look a little bit different. So we would, there's some screening tools and some assessment that's done prior to the start of treatment. We would determine which helmet is appropriate, which protocol is appropriate. But generally they have this helmet. It's just fastened by a chin strap. And generally patients just like to, they'll bring a book, they'll play on their phone. A lot of times they like to talk to our TMS technician and just kind of share about the experience that they're having. And generally they're pretty comfortable, and it's it causes minimal to, if any, discomfort or disruption.
I could geek out for a moment, just to
please do. Absolutely.
The MRI machines, the power of magnets is measured in Tesla. Same as that vehicle that it's named after. An MRI machine is typically about 3 Tesla. That's the power of an MRI machine. And a TMS is about 1 Tesla. So it's about 1/3 the power of an MRI. So that's a pretty powerful magnet. So we're not talking about, the kind of magnets you buy at the novelty store.
Awesome. You geeked out, but you made it really simple. So because I understood that. That's awesome. Tell me, so say somebody goes through a full treatment, they do all the 5 days a week, and they've completed the treatment. Do they ever return, or what does that look like afterwards, or is it do they do other treatments?
If they have a clinically significant response and they have some good improvement with TMS, generally the relapse rate is pretty low. So in the, Dr. Garcia, correct me if I'm wrong, I believe it's like around the 11-12% range, somewhere in there. So occasionally we do have a patient that will go through a treatment and, feel like they've had a pretty good improvement. And then they may a year later, call us up and say, I'm feeling like things are backsliding a little bit. And that's, I think, the silver lining in this type of treatment, because it's non-invasive, of course, coupled with the fact that it really feels like a safety net for many patients, because if they experience an improvement, the correlation between an improvement in a first episode versus subsequent episodes is very high. It's over 90%. And so most patients, feel like I know that that's there. I know that I can do it again if I need to do it again. Because I know that it works for me. I don't have to go back and say, well, I guess we got to start over and go back to the drawing board and try a new med. I can call Aspen and come back in, and insurance has approved patients to do additional protocols if they need to.
Well, it's interesting.
I do think it's important too.
Go ahead.
I just want to make it clear that TMS, a treatment for depression, a very good treatment, but it's not a cure.
Yes.
Depression is a chronic disease, typically, very much like diabetes. And so recurrences do occur. But the good news is, as Lee was saying, that if you respond to TMS, it's very likely you're going to respond to it again down the road if you have a recurrence.
Mm-hmm. And also, from what I know, if you jump back into a medication, takes a while for those to get back, and have an effect. Does it have the same ramp up with TMS, or do you see a little quicker kind of results and start to feel the benefits of it faster than, say, a medication?
Yeah, typically, a medication may take anywhere from 4, 6, up to 8 weeks to become fully effective. But we have seen even response to TMS, even within the first 2 weeks, and then certainly a more robust response by the 4th week.
Wow.
Right. I think in the clinical trials, real world studies that many manufacturers have done, it's usually that 15 to 20 session mark. So about 3 to 4 weeks when patients typically start to notice some kind of significant improvement.
Well, yeah, that's awesome. You also mentioned briefly side effects. Tell me about how those different, what our patients with TMS are seeing in terms of side effects.
Well, I mean, as compared to the typical antidepressant medication, minimal to, if any. I think the most commonly reported effect that was seen in the real world studies and clinical trials was like a mild headache for the first few sessions. And typically that doesn't persist throughout the whole protocol. And so it's, very well managed by over-the-counter pain medication. We've had patients commonly report in the first maybe week or two of treatment that sometimes after their sessions, they feel just kind of tired, feel a little worn out. And so we, often encourage patients, if you feel like you need to go home and take a nap, it's okay to give in to that. You can do that. You're, putting your brain through a lot. Your brain has to sort of adapt to this new stimulus and kind of get used to that sensation. In the beginning, as with any new treatment, it can cause a little bit of anxiety and apprehension, especially because this is something that, while it's becoming more mainstream, we still have patients that come in and meet with us. Maybe they were referred by their provider and they say, I had no idea that this existed. Mm-hmm. And, when they get to see the device, they see the treatment setting, that it's really, it's not, threatening in any way. It's actually very therapeutic and relaxing. We design it that way. They're much more at ease and they know what they're stepping into at that first session. Generally, in terms of, other side effects, there haven't really been any long-term adverse effects from this treatment.
Yeah, because it's so focused. I mean, it just, it's focused on the brain. It has no systemic effect. It doesn't affect the rest of the body, unlike medications that have to circulate and may have other organ system effects. This really has none.
Well, so obviously people come into this treatment, they have been on some medications. Do they continue those medications? Do they taper off? Like what, what's the correlation between the medications that are taking and this new kind of treatment? Dr. Garcia, maybe you want to talk about that?
Yeah, we typically recommend people do not make any changes in their medication regimen right before we initiate, and certainly not during the treatment. We want to remove as many variables as possible, just in case there may be any kind of adverse effect. We want to make sure that, it's not a confounding variable, that's not confusing what's going on. So we tell people to stay on the same medications after they complete treatment. And, once they've shown a response, if patients choose to start coming off their medications, then that's something that they can do, either if they're doing that with their own provider or if they are going to continue seeing us, then we can certainly help manage that.
Awesome. Yeah. So, yeah, Leah, are you seeing that there's a kind of varies from patient to patient? As I said, it's that ongoing kind of consultation with the team, if you will.
Yes. And we have many patients that are referred from, external providers here in our community, and then of course our providers within Aspen. And so just as Dr. Garcia said, they would meet with their provider after treatment to kind of make that determination if they're going to, maybe taper off, because we have many patients that are a lot of times taking more than one antidepressant, or they continue to take that antidepressant with an adjunctive or maybe a mood stabilizer or something like that. And so maybe more of a propensity for the patient to be able to taper off one of those medications. It's really about the expectations, I think, that are set at the consultation, at that initial meeting with the patient, because, we see all along the spectrum, patients that say, I want to stop all my meds. I want to be off all of my meds. That's my ultimate goal, which may not be entirely realistic. And so, as Dr. Garcia alluded to before, this is a treatment and there's nothing that's 100% cure. And that's really our message, in full transparency when we meet with patients, is that the biggest risk to this treatment is that you may not respond. And that is a possibility. But if you're going to respond, you're going to do it here, because we've been doing it the longest. We know our way around the technology. We're really experts in this area. And so we certainly don't make any false promises to patients, and always advise them to follow up with their medical provider in terms of how they would possibly stop a medication. But we have had patients that have been able to do that.
Wonderful. Well, I thank you both for that just fantastic background on TMS. So now let's meet a couple of people that have experienced this treatment, TMS, firsthand. And so please, let's welcome to the show Tracy and Christian. Tracy and Christian, thank you both for being here. Tracy, why don't we start with you? Tell us a little bit about your mental health journey, some of your struggles, and when did you first seek treatment?
When I think I was about 26 or 27 by the first time I went to a doctor for it. But I suffered from depression. I think I was 7 or 8 as a child when my parents divorced, and I stayed with my dad, and he got remarried. And we just had the worst stepmother in the world. And, so after all of that, when I grew up into an adult, by the time I had 2 kids, a full-time job, and obligations, and just, I just decided I got to go get some medication. This is not healthy.
Sure.
So I did, and I've been on antidepressants ever since. And last year or so, I asked my doctor for an additional med, and we did that. And it helped a little, but just not enough. They never helped enough. So this time with the TMS, it just worked great. It was such a relief to have all that weight off my shoulders. I enjoyed it. I talked with the girls, I did all the phone thing and all of that good stuff. And it was fine. I think somebody could actually go to lunch and come here instead and go back to work and feel better.
We do have a lot of people who do that. Tell me just a little bit more, like the antidepressants over the years, and what was your experience with medication? Did you try several? Was it,
Yeah, Lexapro is one, Wellbutrin, Celexa, Paxil, all of them I have tried. I don't think there's much of any that I haven't. So, and right now the combination is TMS, 2 antidepressants a day, and I'm happy.
so how did you hear about TMS? That's
I actually saw a commercial for it.
really,
But I don't know if it was an Aspen commercial or some other place. But I saw the commercials. I saw several from different places, and yeah, I decided to try it. I had nothing to lose at that point.
did you
So,
go into your physician or your therapist and say like, hey, I saw this commercial and tell me about it? Is that how it happened?
No, I only see my PA for medical refills, medicine refills. So no, I don't see them all the time and go months without seeing them. But no, I just for myself, and I checked to make sure my insurance covered it, and said go for it.
That's fantastic. Well, Christian, let me ask you: do you have a similar experience? Where you tried a lot of other solutions before you got to TMS? Tell us a little bit about your experience.
I think I have experienced depression on and off pretty much since I was a child. I wasn't aware that it's just the way I felt. It wasn't until I became a young adult and was in college that I sought some help for it. And over that time between then and now, I've tried multiple prescriptions. I couldn't even tell you which ones they were. I just know that, like, let's try this one. Okay, well, that was not so great, and I'd see a little bit of help with each one, but just kept trying. And I was seeing my nurse practitioner, which is for psych meds, and after having tried a couple and doing an add-on to as a booster, she's like, "Have you thought of TMS?" And I was like, "I'd seen commercials too." So I know how that goes as well. And it's like, well, it kind of really depends on whether my insurance covers it and when
Yeah.
it did. So it's very similar experiences to Tracy.
Well, let me ask you both this. I'll stay with you initially, Christian. If I can bring you back to that first time, what was your first experience, if you can remember, with TMS? Were you nervous? Were you skeptical? Was there any discomfort?
Well, I was a little nervous and skeptical, but I was also open-minded. That was the big
Nice.
thing. Is I just decided, well, I'm at this point where things aren't really working. Let's just give this a shot. And they assured me, it's not invasive and there was no real problems. And I personally had some discomfort with my first session or two, but they worked with me and they adjusted the intensity of the treatment. And what I had was a tightening of my face and my muscles on the right side of my face. And it caused gritting of the teeth. And that's what I don't believe the treatment actually gave me a headache. I believe it was the tightening of the muscles that gave me a little bit of a headache. So between adjusting the treatment and I using a mouthpiece, really got a cessation of that. It disappeared. And at the beginning, I thought there was no way in heck people are going to sit here and read a book or play on their phone. After they took care of that, though, and we adjusted some things, next thing I know, I'm just scrolling through Facebook and not even noticing that the helmet's on. And every now and again, so the little woodpecker comes knocking. It just really wasn't a big deal.
I love that description. That's great. Tracy, tell me about your first couple times. Bring us back there.
I had the same problem. The first time it really, really hurt. But they dialed it down and we did several sessions to work back up to it. And we did that. It was fine. It just, the first day was the only time. And they fixed it even then. I mean, they came in and adjusted it and that really helped. And for the rest of the time, I didn't have any pain. Headaches once in a while, but yeah, I think a lot of that is the neck and just sitting there while this thing is going on. But yeah, it was no problem after the first day at all.
Wow, fantastic! Talk a little bit about the schedules. We talked a little bit briefly about what the treatments are and how long they are. Was it difficult showing up every day for treatment? Coming in, Tracy?
Not for me, because I'm currently not working. But yeah, you could, like I said, go do this over lunch hour or
Yeah.
right after work or something. Yeah, it's so short. It's only 20 minutes,
Mhm.
and you're in and out.
Christian, how
It's
about
worth
you?
it.
Was it
Uh,
easy?
Oh no, I did not have any real problems showing up other than the fact that you're dealing with a depressed person. I was doing it in the morning, so the real problem had to do with just me getting out of bed and wanting to go and get something done. But
Yeah.
I looked forward to it. This was something that was a positive experience. And as I listened to you earlier, Leah, they mentioned that 3 or 4 week mark. But I found that to be true. Right around the 3 or 4 week mark, I started feeling a lightning. It wasn't a magic wand, but it definitely started helping, and that definitely encouraged me to keep going.
So it sounds like it's not like, like when I make an appointment at the gym to see a trainer beforehand, I'm always thinking of how can I get out of this? And you actually really look forward to this. That's
Yeah,
that's
absolutely.
that's that's fantastic. That's certainly different from as I said, me going to the gym. But so tell me that how are you both feeling now? Your treatments are over. Do you still take medications, Tracy? Tell me about
Yeah. I still take my medication. And, I think anyone who is on medication who still requires medication should at least try this. Because it is such a difference than what you're used to. And I remember the first day I was in a good mood for probably the last 5 years. It was because I came here and I had several treatments. I think it was the second week, probably the end of the second week that I noticed. And it was like a weight had been lifted, it was just happy, light, you know, and it was so noticeable,
yeah.
very much. And
Well, I tell you,
I
what's
looked at,
noticeable? I don't see too many people talking about medications, so positively, and just hearing it in your voice and your face, clearly that just talking about TMS. There's a change. I can see it in your
yes.
face. That's amazing.
And I am a number one skeptic, so I was surprised that
Hmm.
felt that way. But it just kept getting better, you know?
Christian,
And I will
Christian, were
come
you?
back.
Yeah, Christian, were you surprised that how
I wouldn't say surprised. I would say that I was just happy that my skepticism was wrong. I was just like, hey, this is working. Like I said, it didn't take care of everything overnight. It
Mhm.
took some time, but I find that it's still working now. And I was told that may happen. That it continue to my depression will continue to lift and become better and more
Sure.
manageable.
Yeah.
And you talked about side effects, and I'm actually 2 week. I've been a hardcore smoker for 30 years or whatever, and I've now actually been 2 weeks without cigarettes.
Yay.
That's
So that's
fantastic.
been a
That's
nice.
really good.
Wow.
It's been a nice side effect. So
Yeah.
yeah. So
Yeah.
I'm pretty happy with that too. Quite honestly, I would have taken it just for that. But
Right.
Yeah.
Yeah.
but what really is important, of course, is the lifting of the spirits. So
Yeah.
I've been
Well, it's
really
noticeable.
satisfied.
It's really
Yeah.
neat. Well, let's bring us all in and have a little kind of group chat about all of this. Really amazing perspectives all around. So let's start. Let's go back to Dr. Garcia. Yeah, TMS has been around. It seems like, as you said, for a long time. What's preventing it from becoming more widely adopted? And it's
I think a couple of things. One, even though it is growing, that a lot of people still don't know about it, and other physicians are not up to date about all the available treatments for depression, and especially these kinds of procedures. I think just knowing about it. So doing something like this is very helpful to get the word out, so people can be aware that there are other options available. Certainly, cost. I mean, it is it's an expensive procedure, and thankfully insurance companies are increasingly approving it, and are typically approving it at a good coverage. And so it is becoming more available that way. Medicare approves it, so that's also a positive. Unfortunately, it's not yet approved by Medicaid. So that's one barrier for people who are with that type of insurance. Yeah, I think the more knowledge gets out there, and certainly with the increased coverage, I think we'll see it more widely adopted over the next year.
I think people aren't going to have to just rely on seeing a commercial. I think we're our clients are, I mean, I know, Leah, your clinic has just been very busy. Our place up in Madison is busy. Chicago is growing. That's brand new. So I think word of mouth, just as we're seeing today, is got to have an effect too. Hopefully that'll. I read that it's more widely used in Europe. Is it a regulation thing here in the U.S. in terms of qualifying more people? Just can again, it's probably providers being more comfortable with it. But what's the difference between Europe and here in the U.S.?
Well, actually, that may have been more true a few years ago. But at this point, I think we've really started to exceed that here in the United States as more insurance companies and payers are approving it. Actually, in Europe, we're running into is as you probably know, a lot of Europe is under universal healthcare system, which I think can be a good thing for a lot of people. But fortunately, there are some healthcare systems in Europe that are not covering TMS, that are not approving it, or that it takes more steps than than it may. So so I think we're starting to surpass our use here in this country now that more providers are approving it.
TMS is just one of the newer advancements in mental health treatment, Dr. Garcia. I hear a lot about ketamine, being used as an alternative to depression and other mental health issues. Tell me, what do you know about ketamine and how it's being used?
So ketamine is actually it's a medication. It's an FDA approved medication that primarily initially was being used as an anesthetic, both in humans and in animals. Actually, you may know that it also unfortunately has been a substance that's been abused or misused recreationally. But there's been a lot of research has been done and trials of people using it to treat depression and even anxiety. Currently, ketamine itself is being used off-label. It's not FDA approved, but because it is an FDA approved medication for other indications, then there are practitioners who are using it off-label, which means that it may not be FDA approved for depression, but it's still legal to prescribe it for other purposes. And so people are getting those treatments. Of course, when things are off-label, usually insurance does not cover it. So that may be a barrier. But there is a form of ketamine that is FDA approved that insurances are starting to cover, and it's called Spravato, is the brand name, which is the generic is S-ketamine. It's a derivative of ketamine that's delivered by a nasal spray, and it's safely done in the office. You don't just prescribe it and take it home. It's something that you come into the office for, and you're doing it in a safe and secure environment under observation, so that you can be sure that it's being used appropriately and also safely.
Yeah, Leah, you can talk more about that. I'm sure your clients are experiencing both, right?
Yes, we're doing Spravato here as well, as another option for that treatment resistant depression, and we're seeing some really promising improvements with patients. It is indicated for folks with severe depression, but then also accompanying suicidal ideation or suicidal thoughts that are really starting to put the patient at risk. And so we've seen some incredible improvement with patients that identify in that specific type of diagnosis of depression that have been treated. And again, non-invasive. It's like Dr. Garcia said, a nasal spray, and so the patient actually self-administers the medication under the observation of a healthcare professional, and they hang out in a comfortable recliner here for about 2 hours afterwards. And that's typically when the medication starts to wear off. So it's a shorter acting medication. And so it's, safe to use here in the office. And then the patient typically has to have a ride home. So they're not encouraged to drive or to do anything strenuous for the rest of the day. But the frequency of sessions is not like TMS. The patient would come in twice a week generally for those sessions.
Well, TMS, ketamine, two of the biggest alternatives on the market right now, correct? Is there what other things are coming down the pike? Anything else? Can we look for more advancements in those two areas, or is there other things that you're excited about?
So there are studies being done in terms of other indications for the use of TMS and, ketamine or esketamine. They're being studied for anxiety disorders. We already talked about TMS being approved for OCD, obsessive compulsive disorder. They're looking at post-traumatic stress disorder. Probably one of the biggest things that looks like it's coming down the pike, if you will, is psilocybin. Some people may know that as mushrooms, hallucinogenic mushrooms. That's very actively being researched, and it looks like it may be FDA approved sometime within the next year or two. But again, it's very important to make sure that if that treatment is going to be offered, that it's done under very controlled circumstances, that it is FDA approved, that it is evidence-based, that the research supports its use. Right now, it's still in that earlier stages. There may be some parts of the country where some people are starting to use it off-label, through different means, but that's certainly not something we would encourage. We want to make sure that we provide evidence-based, FDA-approved treatments.
Fantastic. Well, Christian, Tracy, when people kind of approach you and ask you, what's the change? What's the difference? What do you tell them? I mean, how do you talk about this treatment that you've had such a great experience with?
Well, in my case, I don't think there's many people who really know what I've been dealing with. It's just, I'm thinking about the ketamine now. No, I'm kidding. I don't know. Repeat the question again.
I'm just trying to how do you talk about this?
I don't, because I do talk to it with my side of the family, my sister and my mother and family members, but not everyone.
How do you talk about it with your other, care physician, your physicians and your team?
Yeah. With my physicians, yes, I give them, glowing recommendations for this treatment. I had no problems. I hope other people wouldn't have any problems with it. I love it. I just wish I had known about this sooner. Mm-hmm. I really do. I wish I would have done it 20 years ago or more.
Yeah. Christian, how about you? Do you get asked, or do you feedback to your doctors and say, is made?
My wife was the first person to notice anything, and she just simply noticed me smiling more. She's like, "Oh, so how's that going?" Meaning the TMS, and I was like, "I don't know. What do you think?" Basically, I asked her, and she's like, "No, I've definitely noticed an improvement." And she goes, "You seem a bit more of your old self. You're a few jokes here and there and some smiles that I haven't seen in a while." So she was pretty happy with it, and she actually noticed it probably before I did.
That's funny, because I asked my husband several times if he's noticed anything. He said no. I don't know why, but he hasn't seen any changes.
Well, results vary. No, I'm kidding. Well, thank you. Dr. Garcia, if somebody's interested in seeking help or getting referred to TMS, how do they go about doing that?
Well, they can call Aspen Counseling. Sure. They can mail us. They can get in touch with our TMS coordinator. Her name is Carissa, and she helps to get that process started in terms of obtaining records and handles the insurance authorization. We do everything in our power to take as much as we can off of the patient's plate, because it's kind of a daunting idea when they hear about what's involved in the treatment. And so we do everything that we can to help, mitigate those barriers if we can to treatment. We're kind of the liaison between the referring provider and the patient. And so the best way would just be to, give us a call, reach out, let us know that you're interested, and we'll take it from there.
Fantastic. Well, Tracy, Christian, Leo Scanlon, Dr. Raymond Garcia, I want to thank you all for just what an amazing discussion on TMS, from kind of what it is and what it's like to go through it. It's fantastic. So again, thank you all for joining me in this conversation.
Thanks for having me.
Thanks for having us.
Yes, absolutely. So
Great to
again,
be here.
this has been On Your Radar, a podcast series produced by Rosecrance with locations in Illinois, Wisconsin, and Iowa. Remember, you can make a difference in your own life and the lives of others who are struggling and don't know where to turn. Help is just a click away. Visit rosecrance.org or call 888-928-5278 for more guidance and information. Rosecrance, life's waiting.